Our first speaker is a very unique individual. The brain, I believe, was the person that asked him to be on the Minnesota Board of Dental Examiners. Is that true? Jesse Ventura, wasn't he? He called himself the brain, right? Okay, that's who I was referring to. And Ron, I've had the pleasure of meeting on a number of occasions. He was on the Minnesota State Board for the maximum amount of time of 8 years, and I asked him, and he's also the past president of the Holistic Dental Association, and we could go on and on for all his credentials, but I'd prefer letting Ron have the time to speak than me telling you all of the accomplishments that he's done. He has promoted alternative dentistry for, the last 20 years? Close to it. At this time, I'd like to introduce Dr. Ron King.
Well, I guess we're ready to begin. And again, I'm Ronald King. We don't have a lot of time this morning, so I'm not gonna, you should have a handout in your folder, and it gives my contact information, what I've done in dentistry and outside of dentistry. And there are a lot of resources in there, websites, mostly websites, I guess. And I put those in there so you don't have to sit and write them all down and forget the dots and the commas and all that stuff. So you can more or less just sit back and listen, jot down a few things you might want to ask. But because I'm still a current member of the Board of Dentistry, I was supposed to be done by now. I was supposed to be retired, but Governor Pawlenty hasn't gotten around to finding my replacement. So I guess this might be the first time that a current Board of Dentistry member has talked to you people. And so I have a disclaimer I have to make because the Attorney General said I had to. And that is, I'm not speaking to you as a board member, nor am I speaking to you on behalf of the Minnesota Board of Dentistry. This is a totally separate deal. And I'm also not an attorney. So anything I say, don't construe that as legal advice. Depends on your particular state and your particular situation, the way the statutes and rules are written. So there are purposes for attorneys, I believe. And then the comments and opinions that I'm about to make are strictly my own. And, they may or may not be helpful to you. And this is a pretty lengthy subject, but, I only have an hour or so to talk to you. It's an overview, touch the highlights on things that you need to know, especially if you're going to be biologic, because we do things outside the norm, which the profession at large, both medical and dental, don't like, makes them feel uncomfortable, and it especially makes Board of Dentistry members uncomfortable. But you still want to do what you do, so if you do it correctly or smartly, you'll have a minimum of intrusion from the state board. A lot of dentists, whether you're holistic or not, just kind of go in and start practicing the way they want, and you care more about the new lasers or the new material than you do about the basics that everybody assumes you're supposed to know and that you did used to know back when you graduated from dental school. And then over the years, it just kind of fades away, things change, you aren't aware of the changes, and you get yourself in trouble. Board work, it's a lot of different hats that you wear. Yes, you have meetings and you just make some decisions and you talk about things, and you listen to different perspectives from the movers and shakers from the profession. But there's also the complaint work, which is separate. Not all the board members are involved, at least in Minnesota. 6 of the 9 are involved. We have 2 complaint committees, 3 members each. And all the cases that come in are divided between those 2 committees, and when it gets to a really serious infraction where the whole board has to vote on it, then that comes up before the full board of 9 members to vote up or down on a particular action. And I've been on a complaint committee for about 6 years or so. Presently, I'm the chair of the complaint committee A, And unfortunately, I've had to be involved in making decisions on my peers, hygienists, dentists, assistants, both with non-disciplinary agreements and disciplinary orders, including loss of license. This isn't fun. I don't like it, but unfortunately there are cases when this is appropriate. Most of the time it's agreements for corrective action, which isn't as bad, but if you're the person getting that agreement, you don't think it's good at all. I've had to look at thousands of complaints, thousands of dental records and investigative reports by the Attorney General's office, and I've participated in 175 plus meetings with licensees, and some of them bring attorneys, and that's not pleasant either. And if you don't really know, if you've never been there, it can be quite intimidating. For sure it's demoralizing and usually adversarial. And I tell you that because it really doesn't have to be that way for the most part. You just have to prepare properly. You have to really understand and accept how the regulatory process works if you want to defend yourself effectively and with the minimum amount of damage to your license and your pride. Most people choose to defend themselves. They think they're completely right. They use principle, logic. They get all kinds of expert witnesses at great cost. They use an attorney. And I can tell you, most of them still come out on the short end of the stick. And even if it's not professionally because you avoided a stipulation in order, it's certainly financial because all that costs a lot of money. And it takes a very big emotional toll as well. We've had people, dentists included, cry during this process. And if they don't cry, you know, they're shaking, their voice is quaking. It's just not, it's not pleasant. You don't want to be there if you don't have to. And how you do that is by prevention. And we as dentists really understand prevention of dental caries, gum disease. We know that's really important. How many patients think it's important, what really happens is another story. Prevention is the key. And so this is what I meant when I said you have to know the basics. Everything that basically you think is boring, we should delegate to your receptionists and your dental assistants. You just don't want to deal with. You know, you're there to do dentistry. Well, that's the Achilles heel. You're going to get yourself in trouble because you're the captain of the ship and you're held responsible. So every state has statutes and rules, which is called your Dental Practice Act. And for many states that changes every few years. So how many of you have a current copy of your state Practice Act and have read it thoroughly? Raise your hand. Okay, the rest of you are going to be probably in complaint committee sometime in the future because you really don't know what you're expected to know. This is a huge, huge mistake. I have to admit that when I got on the board, I hadn't read mine for 20 plus years. And just because by the stroke of a pen, the governor says you're on the board, you're supposed to know everything. Your practice is supposed to be a model for others, which is a little bit ironic, but there you are. And so if you're going to be judging others, you better know what you're doing, and you better believe I got a current copy, or as actually a benefit from being on the board, you get a free copy. And I was reading, and it's really dull and boring and legalistic. But you need to read it, you need to understand it, and if you don't, ask somebody who does. That's number one by far. Then everybody knows there's CDC regulations, and I'm sure you all know that in 2003 they changed from the ones that were long-standing from about, I think, 1993. And they have changed a bit. So you can contact the CDC, you can get it written, or it's certainly on the website. How many here have gone over the 2003, fully understand it, and gone over it with their staff? That's another big mistake. The boards take infractions of CDC very seriously. You need to be the captain of your ship, and you need to know this stuff, whether you're holistic or not. How about OSHA, which is very similar to CDC? CDC has to do with spreading infection to your patients. OSHA more is related to your employees, protecting your employees, which are many of the same issues, but additional ones as well. So you need to know the OSHA regulations and guidelines. That's also on the web, and again, all those resources are in your handout. Another thing is employee rights. What can you do as an employer? What can't you do? You can get yourself in trouble by just not paying overtime. There are certain rules on that. Do you pay it when it's over 8 hours a day, over 40 hours a week? Are you exempt because you do your practice differently? You're in healthcare. You need to know that. Radiology standards. I'm pretty sure that that's all around all the states. Minnesota, we have to have our equipment checked every couple years. An inspector from the Department of Health comes in, checks your equipment, checks your processing, your darkroom, your documentation of testing solutions. You need to know that. And even if it's not a regulation, it's a good thing to know to make sure your equipment is working correctly. HIPAA. Everybody's heard of HIPAA. That really is a federal jurisdiction. That's not a state jurisdiction. If you have a HIPAA violation, you can have up to a $10,000 fine per infraction. The state board really won't get into that, but you can better believe that if there is some sort of infraction of personal health information, somebody's going to complain, it goes to the board, and that opens up the door to other things in your practice. Insurance and dental codes. Every odd year, American Dental Association puts out a book on insurance codes, and they change. And obviously this is an odd year, 2007, so how many have read through the CDT book and know all the insurance codes and how to apply them correctly when you submit insurance? Not a lot of hands going up. I mean, we've covered a lot of things that you're going to get caught in before a complaint committee. Because improper use of insurance codes, at worst, could be considered insurance fraud, which is a felony and you can go to jail as well as pay a fine. It's hard to prove fraud, but that's what the boards are going to be thinking. Proper record keeping. This is huge. Good records can keep you out of trouble or at least minimize the damage. And I know Dr. Margolis is going to be talking about this tomorrow. So take this very seriously. Like I say, I've seen thousands of dental records, and I can probably count on two hands how many I consider to be adequate. It's not that they're all poor, but there are certain segments of record keeping that it's just totally inadequate. And it's a little ironic, you know, the records are very inadequate, and then you come before the board, and the dentist, 3 years after the incident happened, have pages and pages of elaborate information, what the patient thought, what they thought, what color shirt they were wearing, what the assistant did, all this and that. I mean, how many people can really remember from last month what they did? And also that we as a board look at that a little suspect. How much of that is fiction? How could your recollection be so darn good with all those patients you see and your records are diddly squat? Record keeping is very, very important. And then government program restrictions such as medical assistance. Probably everybody has medical assistance programs in your state. And it seems, at least in my experience, the people that, as a group, that get things for free and tend to complain the most and don't show up for their appointments. And then when something doesn't quite go perfect, then they want you not only to write off all the fees, but maybe give them money to get it fixed the way they want. And people like that do not hesitate to use the government for other actions, such as the state board. Okay, so you probably should know who makes complaints, because if you don't know who to be careful with, you're probably going to get yourself in some problems. Obviously, unhappy patients make complaints, and whether the concerns are valid or not, if it goes to the board is obligated to look into it. Could be the most outrageous complaint there is, but the board cannot just dismiss that without a little bit of work on it. You can work on a person that's very ill, has a lot of health issues, and they're totally in agreement with the treatment plan. You're doing everything above board, and then the relatives or the spouse of that person hear of what you're doing. They totally don't believe that what you're doing has any value, and then they make a complaint to the board on behalf of their loved one. Because they weren't in on the treatment plan, they weren't in on the consultation, they aren't even paying the bill maybe. But they don't like what you're doing, and they feel that you're taking advantage of their loved one. So that's a communication thing, especially written communication. Patients, and we've all had them, they come in, they say, you know, I've been to 15 dentists, 30 physicians, and I got a referral to you. I heard you're the best dentist in the whole world, and I know you can help me. Please help me. I'll do anything you want me to do. Well, right away, you should just get up and, I don't know, consider to not treat this person. Just finish off that consultation or exam appointment and then make up some excuse. I don't care what it is. Just say, I can't possibly see you. I can refer you and then refer him to someone else you don't like. Because you're next in line as someone who's inadequate. You failed me. Don't let your ego get in there and think, oh yeah, I know who you saw, and he's okay, but I can do a lot better. You are in big trouble with that patient. Disgruntled former employees, former dentist associates you've had. You think these people are in your family of workers who care what you do, are empathetic, they fully understand, and they are, until you fire them, until you don't give them a raise, till you somehow make them unhappy. Now, instead of being a confidant, they're an informant to the state board. They know things you've done, things that are kind of gray, they know things you've done that are actually probably illegal and everybody knows it. They know you said things like, oh, don't worry about this. We can do this. The board doesn't have to know. They know, and they tell. So you have to be very careful what you say. In fact, I'd go so far as to say that anything you say to a patient or your staff, or if you're lecturing, you assume a board member from your state is sitting at the front table listening, taking notes. And don't say anything that possibly could be used against you. It's not that you shouldn't say it necessarily, but it's what words you use. Semantics is very, very important because we're talking about a legal process. Temporary employees, from these agencies that come in, and most of those temps aren't going to be biologically minded, and they're going to come in and they're going to look and say, oh my God, look what this person's doing. It's kinesiology, or what's this dental materials report? I've never seen anything like this. What's compatibility? And so they finish off the day and then they tell their employer, I never want to go back to that office. They're weird. I didn't learn this in dental school. And, I think I should maybe make a call to the dental board because something's not right in this practice. Subsequently treating dentists, you've worked on somebody, you've either completed their treatment plan or not. they've moved, they've gone down the road, whatever, the next dentist looks at the notes that you've been requested to send over, and they're thinking, what the heck is this guy doing? And why? This doesn't look right at all. This is malpractice. I don't like him anyway. I think I'm going to turn his name in. And in Minnesota, complaints can be anonymous. Now, we just recently made a ruling on that. We decided that they can't be totally anonymous. You can request to not have your name be given to the licensee that you're making the complaint against, but the board has to know who you are. But up until just really January, when we reaffirmed that, you could just write an anonymous email, slip a note under the door that had just as much weight as somebody had their name on it, and we are obligated to investigate that. Insurance companies, they have a computer printout on what you do. They know how many amalgams you do, 0. They know how many composites you do, a lot more than anyone else. They see different things going on, and you're just outside the norm as far as what you are performing. And that puts up a red flag. And sometimes they'll just come in and do their own investigation to see if they want to still work with you. And then if it really gets nasty, they'll file a complaint to the Board of Dentistry. All right, so enough for the happy news of who you can trust. I mean, who can you trust? That's really a good question. Okay, some of the most common complaints are obviously substandard care. And I'm not really going to talk about that. I mean, if you're doing stuff, do it to the best of your ability. Nobody wants any practitioner that's just doing shoddy work. Unprofessional conduct, that's kind of a general description written in statute usually. And it's just kind of a catch-all that if there's no specific infraction, they could kind of call it unprofessional conduct and get you there. So just think about that, and it more has to do with relationships with your patients, as you can see, about rudeness and terminating patients from your practice, not responding to emergency calls when you're on this cruise next year to with this organization, not having set up an emergency contact when you're not available, that kind of thing. The next one, practicing outside the scope of dentistry. What that means is dependent upon the language in your statute that describes scope of practice, and the language is different for different states. And it's often very gray. And so nobody really knows what that means. And so it comes down to maybe what a bunch of board members think, and more often than not it comes down to case law, where maybe issues like that have come up in other states or even in your state, and whatever has happened before becomes a precedent. Whether it was right or wrong becomes a precedent, and they kind of use that as this is what you should or should not have done. There might be one or two of you in here that use modalities that would be considered outside the scope of practice. And you're going to have to think about using those modalities yourself. One possibility is have somebody who's not licensed use them, and you just use the information that you get from that. Or you don't use them. Or you have your patient, they just have used it on their own. They've gone out, found a practitioner that did, and they just happen to bring in the information, and you just put it in the chart and just happen to glance at it and read it. But you don't necessarily write anything in your chart about if you used it. It's just sitting in the chart, those kind of things. But you have to think about that, because if most of your peers aren't using that modality, that's going to be looked upon and scrutinized by the board, who has no idea themselves what it is. And those are the people judging you. Practicing outside the prevailing standard of care. That's doing things that everybody does, but you're doing it differently. Big one is orthodontics, functional orthodontics as opposed to 4 bicuspid extraction orthodontics. There's a lot of courses out there. A lot of dentists are doing functional orthodontics, but their records are really poor. You know, they'll just take a couple of casts, put them on an articulator with their wrists, and say, yeah, this is what I got. And it's not written down anywhere. They just kind of base, you know, they may be right. They may be really intuitive or really experienced, but I can tell you that's not how orthodontists do it. Even for the simple cases, they mount it on an articulator. They have photographs. The model's all trimmed nicely. They had to do all the ceph tracings, all that stuff. If you aren't doing that too, you're in big trouble. Substandard infection control, that relates to the CDC. Lots of infractions that I see all the time. And again, record keeping. I still hope there's, well, when I got out of school, the thought was, how little can I write? Let's try to put it on a 4x6 card and just use abbreviations and then put the fee at the end, and that's it. And I should hope nobody's even close to that right now. You should really be to the other extreme where it's almost a book. And it doesn't make it right, but that's understanding what the board wants. And probably you should use the thought that if I bump my head and I got some temporary amnesia, could I read that record? Is it legible? Could I read that record and know exactly what I did, why I did it, and all the materials used and all the documentation that supports that? Anybody could look at that, even a non-dental professional, and they could tell what happened from your record. If you can't, you're in trouble. Type it out. This is true. Yep, you're right. And that's definitely part of it, legibility. Another big one is informed consent. Not only is there misunderstanding what informed consent is, but you don't get it. And that at least you don't write down that you got it. And then if you write it down or you got it and then you don't honor it, now you're in trouble. And I mean, you said you're going to do this great big MODF composite on a second molar. You're going to be heroic because the patient can't afford a crown or whatever. You get in there and you decide there's no way, there's no retention, I'm going to do a crown. So you do a crown, sit up the patient at the end of the point and say, you know, it was so bad I decided to do a crown. And they just look at you incredulously and say, I did not authorize a crown. I said I wanted a filling. Why didn't you stop and tell me you couldn't do it? I wanted some input on this. And they walk off mad, they don't come back. Next thing you know, you get a letter from the state board. You know, this person physically abused me, battery, assault. They did something to my body that I did not approve of. Informed consent's big. Billing errors to insurance companies, that's getting back to know your insurance codes. And the biggest one is, you know, when you submit for a crown and there's different kinds of metals, you can have precious metal, semi-precious, and non-precious. And at least the general dentists, the conventional dentists I see, they have not a clue what metal was used. And they just submit a code, and it's the wrong code based on the type of metal. Well, there's a difference in how you're remunerated from that code, from the material, even though the fee might be the same for all the types of crowns. Well, at worst, that's insurance fraud. Less frequent, but common, are improper delegation of duties to your assistants and hygienists. And that not only includes having them do what they're not allowed to do legally, but it's having them do things they are legally allowed to do, but under the wrong level of supervision. And that's commonly done, it seems. Failure to copy records and send radiographs to the next dentist they go to because they left your practice for whatever reason. Minnesota has a law that you have to do this in a timely manner. You can't refuse to do it even if they owe you money, even if you normally require a fee to copy and send, and they refuse to pay it, you have to send it off. You can bill them and then send them to a bill collector, but you can't say, no, sorry, you're not paying my fee, I'm not sending the records. That's an infraction. Misleading advertising, that's kind of a gray area too. Our state is struggling with that at the moment because we found out that you need to have a certain study to support that law, and it gets kind of complex, but there are laws against advertising what you can say. And even if it's not illegal, you might want to be careful. It's better these days now, but if you go out and put ads like, I'm mercury free and that stuff can kill you, and I like to use electrodermal screening and Ray K energy to heal you in an ad that everybody's going to see, boy, that's probably not a good idea either. Exactly. And even if you're at an expo exhibiting or wherever you might be, it might be better just to be a little bit more low-key. Excessive fees. Well, what's excessive? I don't know. But if they think that you overcharge them for something, and that's part of informed consent. When you do informed consent, you should tell them what all the fees are. You don't say, well, a crown is $900, and that's it. And they okay, yeah, do a crown. And then when they get the bill, it was $900 for a crown. It was $300 for a build-up. It was $500 for a crown lengthening procedure. And by the way, I had to do a little bit of a occlusal equilibration to get the right bite on this. And now the fee is $1,800 or whatever it comes out to. You got problems. You better put everything in. If you're going to make it high. And then when the fee's lower, they just think you're the greatest thing on earth. But the other way around, you're just trying to take advantage of them. And then, of course, there's always the substance abuse and addictions that everybody can have, whether it be alcohol, marijuana, cocaine, meth, all those different things that we're all addicted to in this room. But the other thing that can be a problem is DWIs. At least in Minnesota, that causes big problems. I mean, you can be off on vacation, not practicing for that week, just get snockered, having a good time, and you get pulled over and you get a DWI. Doesn't mean you're impaired when you work. It doesn't mean you do it all the time, but it's on your record now. Now that sets in motion, at least in Minnesota, a whole cascade of acts that you're branded for life. And it usually goes to the state board when you have a conviction, a court proceeding, and then the board has to decide, boy, is this person competent to practice? So then you come in and you talk, and then in Minnesota you have to go to this organization called HPSB, Health Professionals something or other, and usually what they want to do is monitor you for 3 years. You have to have sobriety tests, blood tests. You have to call up in Minnesota and see what color it is, and if you're that color, you have to then, within 8 hours, go to some facility, have your urine tested, and it can be a hassle. And if you just happen to have even a poppy seed roll or something, you can get a negative test result, and it's just try not to get to drink and drive. I guess that's what I'm saying. Yeah. If you receive a complaint, or actually when, because we're all going to get one. I got one when I was sitting on on the board, but it was dismissed. It was in the other committee, so I didn't have anything to do with it. But you need to fully understand what the allegation is, and then look up the statute and rule that applies to that allegation. And that goes back to owning your most recent copy of your Dental Practice Act. And then you want to read that statute or rule very, very thoroughly, read it multiple times, make sure you fully understand it, probably even memorize it. Then, after you've done that, and now you're totally pissed, Do you ignore it until your anger is past? That might be a good idea unless it's going to go on for months. Do you immediately write off a 4-page letter, single-spaced letter that says, man, this is total stupid. I can't believe it. This patient's a quack. I can't believe that you guys are even bothering to contact me and waste my time. I don't think I would do that. It just makes people unhappy, and it makes you appear in a bad light, very unprofessional. The board has to, whether we want to or not, every single complaint, because the legislature mandates, that's why we exist. We have to do it. So don't blame us. We're just doing our job. You could try to contact the person who made the complaint and bribe them. Be real nice and stuff. It doesn't make the complaint go away. We've had people say, you know, we've had a heart-to-heart talk. I misunderstood the dentist. I was totally wrong. I shouldn't have submitted this complaint. It's been resolved. Please withdraw the complaint. Thank you very much. Can the board withdraw that complaint? Nope. Has to continue on. So it's better not to get the complaint filed in the first place. Contact your malpractice insurance agent. Probably it's a good idea because they'll have lawyers on staff that can help you, probably at no charge. I would definitely call them before you responded to anything from the board. Consult an attorney, maybe. It depends what the attorney knows, how experienced they are in complaint matters against health professionals. Depends on the attitude of the attorney. Some of them charge a lot of money. And this is outside the attorneys from maybe the malpractice insurance company. Maybe, you know, if you have some good input from people that have been in the process, you know, maybe you only need to consult an attorney for advice on what to do, but they don't need to accompany you to the hearing or whatever. To prepare, know your board's complaint process and options. There are options. Sometimes on the website, and it's not really clear as to what the process is, and it's written up in such god-awful legal language that you can't understand the letter or what they're saying in the first place. I mean, when I first got on the board, it was just totally over my head, and it's time to get off the board because I think I really understand it and appreciate it now. And but you have to know what your options are, and if you're not sure, ask. I mean, that's public information. And know that everything's negotiable. It may not sound like it, they may not speak like it, but it's just like playing poker. You're at a table, and you listen, and you just look them in the eye, and they look you in the eye, and you don't argue, and then, but it's negotiable. They may want one thing, and if they can't get it because they're on shaky legal ground, but if they can get it, you capitulate, well, they got you. If you say, no, you can't do this, and this is what I'm willing to do instead to satisfy your concern, they'll probably go for it rather than spend any more time and money on it. And know your legal rights. Not because the board is try to do things illegally and not follow due process, but it happens. You get new committee members, you get people that are overzealous, maybe even unintentionally they try to intimidate you. They can tell when you're shaking in your shoes and if you'll accept something, and if they can get you to do it, but legally you don't have to, well, what's going to happen? You're probably going to say, oh, heck, it's just easier. So know your legal rights and don't panic. Whenever there's this one attorney in Minnesota that she is a former nurse, now an attorney, and she's very, very good. When her licensees come in, they are prepared to a T. They know exactly what they did. They have a response. They've taken courses, which we'll get into, ahead of time. And they usually get off with a close. Okay, we've heard what you said. You've remedied things. Thank you very much. Goodbye. But the other attorneys who really maybe don't know what they're doing or approach it differently, they'll go out with an agreement for corrective action, which is not disciplinary, but it's still on your record, and you have to do a bunch of things to prove to the board that you're practicing properly adequately, safely. And if you don't have to have something on your record, that's good. Or worst case scenario, you go in there like a bull in a china shop and just are belligerent, you might come out there with a disciplinary action, which affects your ability to work with insurance companies. It goes to the National Practitioners Data Bank. It affects your premiums. It's just not good at all. And so by now you should see that informed consent and record keeping are really important. So this isn't on your handout, so I'd like you to write this website down. Because this is the State Board of Minnesota website, and on this website there's a link on the left side towards the bottom that says Board Resolutions. They're really educational handouts, but the Attorney General said we couldn't call them educational handouts. We had to call them Board Resolutions. When you click on that, there's about 10 separate board resolutions. The two that are the most important to you are the ones on informed consent and record keeping. If you can understand what's in that handout and apply that knowledge, you're going to be way ahead of the game. Because most people don't understand record keeping, which Dr. Margolis will be clarifying for you tomorrow, and nor understanding what informed consent means. I would do it for a recall exam. You know, they come in there and your typical programs that do an exam, bite wings, maybe fluoride, probably not in this group, and a prophy. And unbeknownst to you, the parent called them and said, you know, I don't want x-rays this time. Just do an exam and a prophy. Well, the information doesn't get back to you. You go in, or your hygienist just goes in and you do that, comes out. Well, we did an exam, bite wings, and a prophy, and there's no decay. And the parent looks at you and says, bite wings, isn't that x-rays? Yeah, it's been a year or 2 years or whatever, or I saw something suspicious. And now they get irate. And they said, I told you not to do bite wings. If you would have got informed consent from the start when they dropped the kids off or said, no, today we'd like to do an exam, take x-rays and do a prophy. Is that okay with you? No, I don't want you to do bite wings. Problem solved. So I do it for every procedure. Okay, so let's say you have or possibly have, you don't know, it's kind of gray, broken the law. Don't wait for the board to determine what infractions you have. Like they're the judge and you're just going to wait and see what they say. You start working on this complaint right away. If you have to cancel patients, cancel a trip, whatever, do it. You should begin self-directed education courses, books, lectures that target the infraction. So it has to do with record keeping, take a record keeping course. If it has to do with endo, maybe take an endo course. Whatever it might be, even if it's online or a book or whatever, start reading, learning, documenting what you did. Consider writing up a little report of what you learned and start making a file. And then make changes to your practice. Put it in your policy manual. Train your staff and document that when and what you decided to do in those training sessions. And then have the staff sign it. And then try to understand really what the board might be concerned with and strive to satisfy those concerns. Again, the board really isn't a bunch of bad people trying to get you. We're trying to make dentistry safe for the public. And if you can alleviate our concerns, everybody's happy. If it doesn't look like you give this any kind of import, or you're just going to do what you do, or something like that, it comes to push or shove, well, the board's going to push. Keep in mind that if you're asked to write a response, which almost always you are, do not admit in writing that you have broken the law, even if you have. Do not admit it. Because right then and there, they can just say, okay, based on this, this is what happens. You can forget about an attorney or all the defense that you might have. It's a done deal. You admitted it, done. You can use euphemistic language like, oh gosh, this is really a bad allegation. I really don't think that this is warranted, but I'm really concerned, and I'm going to make some changes, and this is what I'm presently doing. Although unfortunate, I welcome the opportunity to improve, something like that. And the proper defense is to respond only to the specific allegations that are in the letter or the notice of conference that you get. Don't get there and start trying to be chummy and say, oh, hi, how are you? Oh, that's a nice suit. And yeah, my practice, this is a great practice. I've been there for 20 years, and I like to do all kinds of things. And I love kinesiology, and I love to do this and that. And these patients have gotten better when I've done, removed amalgam. And the allegation had to do with record keeping. Don't even go there. Don't say a thing. Don't offer any information, because that's the foot in the door. Now, because you mentioned it, now they can ask you about it. You just get in deeper and deeper. Know the allegations and only respond to those allegations. So let's say you're asked to come actually to the board offices for a nice little chat, which usually involves you, maybe your attorney. It involves a number of board members, the executive director, board staff, and maybe an assistant attorney general from the AG's office. Well, that makes you feel like a little kid sitting on a dunce stool, naked, in front of all these people, these powerful people. And make no mistake, board members are extremely powerful on what they can do to your life. So you can go in, which I've heard about, I'm right, you're wrong, let's duke it out. And I'll show you, you're just full of it. Not a good approach. I'm wrong, you're right, oh my God, I'm at your mercy, do whatever you want with me, I just want to keep practicing, I'm really, really sorry. I don't think I would do that either. They'll walk all over you. I knew we'd disagree. This is the most common approach. I knew we'd disagree, but I'm not going to do anything differently until you tell me what I've done wrong, and that's why I'm here. So let's talk, and let's get some sort of resolution. That's a really bad idea, too. Because now the board is going to have you do things that you probably don't want to do, and you're stuck. Should have done that before you even got there. Or, I was really concerned about this complaint, and I've made changes already. I'm really open to improvement, and I appreciate this opportunity to talk with you folks to really clarify what the issues are. Let's dig in and let's see what we can do. Very few people do this, but if you do this, everyone's happy. They'll shake your hand at the end. They'll say, thank you very much. You're very cooperative. We appreciate you're doing things a little differently, but you have all your ducks in a row. Peace. Go off. Also anticipate what the board might ask. Don't go in there unprepared. You don't want to be sitting there, they ask you a question, you go, I never thought about that. It's a good question. And then just spew something out of your mouth without thinking, and then it turns out to be the wrong thing, or it was taken incorrectly. At the conference, dress professionally, coat and tie. Now, I don't usually wear a coat and tie. I did it because, first impressions. I wanted to make you think that I knew what I was talking about, and a coat and tie helps. But most of us are pretty casual people. We just kind of go along, but you can't do that in front of a board. You better dress smartly and brush your teeth. Be polite, cooperative, but be confident. Don't be meek. Don't look down at the floor and kind of look them in the eye. You did what you did because you really believe in it and you have some education to back that up. But yes, it's different. But, I'm willing to talk about it. Be organized, have everything with you. Use a respectful tone of voice. Don't sit back in your chair, laid back like this, and okay, ask the questions. Sit upright, just be respectful. Don't argue or become defensive, because when you do that, then they do that. It's called mirroring. And it serves no purpose. Do not be disdainful of the process or disrespectful of the board members. Again, we're not bad people. We're there to do a job. We had to do just as much preparation, if not more, to prepare for the conference as you did. And we want a resolution we both can live with. And for sure, don't belittle the patient or the person who made the complaint. They made it because they were concerned, for the most part. Maybe they were a little goofy, but that's kind of belittling the process. So again, the proper defense is to respond only to the specific allegations. Do not answer any questions or voluntarily offer any information about your practice that does not involve those allegations. Don't be afraid to say, I'm sorry, I'm not prepared to answer that question today because it was not one of the allegations. Don't say, I refuse to answer that question. Because it looks like you're being uncooperative. Give a reason, and that is, it wasn't one of the allegations, so I'm sorry I didn't have time to prepare an answer for that. And I don't want to say the wrong thing or give you a flippant answer. Don't be afraid to take time to think before you answer. I mean, you're in a very nervous situation, unless you're just used to being in front of people and just winging it. I mean, you're shaking, your adrenaline's pumping, your mouth is dry. It's not a fun situation to be in to do your best work. And don't be afraid to stop the conference. You don't have to bring an attorney with you. And if you don't, if it starts getting a little bit rough in there, then stop the conference. It's due process. And you can say, this isn't what I expected. I don't feel prepared. I'd like to stop this conference and reschedule, and I'd like to bring my attorney with me. They have to honor that. Not that I'm saying bring an attorney, because sometimes I think people are spending money on attorneys that you don't have to. Just depends what the infractions are. So you're at the end of the conference, and they say, okay, doctor, we feel there are issues in your practice that need improvement, and this is what we offer you. Blah, 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 blah. It's usually coursework. It's usually writing reports. Depending on the level of arguments that you're in, there could be some fines. Could be volunteering, giving away, I forget what they call it, give away your work for some cause. But you don't have to accept what they offer right then and there. If you're willing to accept it and you think that's fair, then do it. If you're not sure or you really don't like it, just say, thank you, I'd like to receive this in writing and consult with my attorney, and I'll get back to you. And then you can accept it, and you can even make counteroffers. This is where it's negotiable. Make the counteroffer reasonable based on what you know their concerns to be, but you can counteroffer. And then I've heard instances where they insist, not in our state, but they insist that you make a decision right now. You cannot leave the room unless you tell us what you're going to do. Otherwise, we're going to pull your license right away as you leave this room. They can't do that. That's not due process. That's totally illegal. And if they do it, now you got them over a barrel, because now they've broken the law, and that will stick. Failure of due process. It may take a while going through courts and stuff, but don't let them intimidate you. And realize that ultimately you have to decide what you can live with. Do you fight it to the death at all costs? Do you mortgage your home? Do you spend just months and months on this? Or you just say, I don't like it, but I can live with this. I can still practice pretty much the way I want to practice, and it's a blemish on my record. My pride's hurt, but I can live with this. That's what you have to decide. Don't be so principled that you're going to go down in flames. And know, again, that the board is all powerful. In Minnesota, again, I said there's 2 complaint committees, 3 people on each committee. It only takes 2 or 3 votes to make it stick. So 2 people can determine your life. And when it's gone to appeal, gone to a contested case hearing with an administrative law judge, or in other states it's gone to different courts, and they come down and say, you know, board, I think you are wrong. I think this is what I would suggest. The board does not have to listen to that suggestion. They can say, thank you, judge. We appreciate your input, but this is what we're going to do. And it sticks. Basically, the board can do whatever it wants. And I don't know if you know Doug Phillips from Florida. They pretty much did that to him. I looked at that case and I looked at the allegations, and I know all about when he went before the judge, and you know, it was just totally ridiculous to take his license for the allegations, the actual allegations. And he spent a lot of money on his defense over many years. So I think that's it. I know that there's a lot of people in this room that